Thanks for joining us on this edition of National Focus. I'm Kimani. In the headlines, World Health Day observed today, April 7th, and the Ministry of Trade prepares for a national seminar to explore opportunities in trade agreements. Details of our headline stories and others after this.
Did you know the Caribbean Court of Justice is two courts in one? The CCJ has two functions: an original jurisdiction, which deals with your right to move between CARICOM countries freely and your right to move your money and your business. This is the basis of the CARICOM Single Market and Economy, CSME, and the revised Treaty of Chaguaramas, and an appellate jurisdiction to hear appeals from courts of those countries which decide to use it as their final court of appeal and no longer go to the Privy Council. All CARICOM member states who have signed the agreement establishing the CCJ are members of the CCJ.
Thanks for staying with us. The Environmental Health Department is focusing on consuming healthy fish for this year's World Health Day. World Health Day is observed every April 7th since 1950. This year's theme is food safety. World Health Day commemorates the establishment of the World Health Organization and also draws global attention to the importance of health. In countries around the world, food safety forms part of public health action to protect consumers from the risks of food poisoning and foodborne diseases. Food safety is also a priority in Dominica.
We in Dominica see food as very important because food basically now food is a globalized commodity. That the food that you eat now in Dominica is, if you look at Dominica in terms of the supermarket, you find like about 80% of the food is imported food into the country. And food has been seen now as a tool for development, you know, to promote your tourism industry, your sort of exotic food, your cuisine. Also a form of producing livelihood for people. So it is one of the biggest areas for employment in terms of the production of food.
Over 200 diseases are caused by unsafe food, and it is estimated that 2 million people die each year from contaminated food and water. In 2015, the Environmental Health Department will continue to place emphasis on the proper handling of fish.
This year, the Environmental Department is concentrating on fish sanitation because the way we see fish is being handled and managed in the environment is not up to standard. We still have people selling fish without ice. The way fish is being cleaned and prepared in near shore waters, that is like on the beach shore or in the river mouths, and these waters are contaminated. You're looking at the sale of fish, where fish is being sold, and some of the locations are not sanitary. The Japanese have given Dominica a lot of assistance in terms of setting up fisheries complex around the island, and we want to see more people making use of these complexes. Some of the fishes that are being sold in the environment, which is dusty and unsanitary, and creating problems to people living within the immediate neighborhood.
One way of ensuring fish is fit for consumption is to clean and put on ice while at sea. The Chief Environmental Officer says his department is working with the Fisheries Division to bring more awareness about the proper handling of fish for consumption.
We want to do joint inspection at the fish landing site. So actually we'll be going there jointly, the environmental officers, the fisheries officers, to see how the the catch is landed and how it is treated up when it is landed. And actually to instruct people in terms of how they need to prepare fish and how they need to, in terms of before they offer it for sale. You have also, we're going to be holding some town halls meeting around the island, particularly where you have the fishing communities, where you have cooperatives, and we are linked up with village councils, the cooperatives, and the consumers within those environments to discuss the issue of fish sanitation.
He says though some improvements have been seen in some fishing communities, there's still more to be done to ensure that every catch is fit to eat. Environmental Health Officer in the Roseau area, Carmel Luis, details how consumers can know that they are buying safe fish.
You need to look out for color, the fish color, which is bright, so red gills and bright skin. You need to look for the odor. The odor would be mild ocean or seaweed smell. And the eyes, bright, clear eyes, and it's not puffy. You know, you look for those things. And the texture will be firm, fresh, and when you touch it, it springs, it bounces back. Your storage, make sure that you purchase food or fish from which is on ice and in proper containers, not in a wheelbarrow, not in a truck or anything, but it's supposed to be properly stored on ice. Fishborne illness is a very serious thing, and it too can be life-threatening. It happens instantly. If a person eats some bad fish, then it would just start to create respiratory problems and nervous problems, and eventually the person can die as a result of that.
Over the past decade, the government of Dominica has made food safety a public health priority. Several policies and regulatory frameworks have been developed with the aim of establishing and implementing effective food safety systems. Some of these include the establishment of a national health surveillance system to monitor and investigate foodborne diseases outbreaks on the island, the establishment of the Bureau of Standards, and the establishment of an associate degree in environment health at the Dominica State College. In more World Health Day news, GIS News spoke with Environmental Health Officer Carmel Luis about the general proper practices for food handling. She says individuals who are preparing food should always be properly attired, wearing hairnets and aprons. She also spoke of the importance of maintaining clean hands.
One of the most basic things of a food handler is hand washing. So a food handler must ensure that their hands are washed at all times. During the time, if they are handling anything, and a pot or aside from the food that they are preparing, they need to wash their hands. For example, we always tell food handlers, wash your hands after using the washroom, after blowing your nose, after putting out the garbage or doing the dishes. And when I say doing the dishes, somebody coming to purchase, they eat. So after you have emptied the table, it is important to wash your hand. Why? Because there may be contaminants. The person may have touched something that can easily contaminate the food if you didn't wash your hands properly and cause a foodborne illness.
The Environmental Health Department conducts sessions twice monthly to certify newcomers as well as existing food handlers on the island. Luis says every person who handles food for public consumption must be certified. She added that the establishments used for preparing food must also be up to par.
Given the fact that people have their leftovers, they would dispose of it in the drains, and this would be a harborage, or this would be a cause for rodents. Right? So if some of the food places are not designed for food places like what we have in Dominica, a number of food places are not designed for food places. And sometimes it's a dwelling house or a little place that somebody just makeshift to make $1. And because it is not properly sealed to prevent the entries of pests like rodents, you may have rodents, a few problems arising. But if they realize this problem and they put a pest management program in place, then usually after follow-up, you would see that the problems have already been solved.
Maintaining these healthy practices must be taken seriously, she says, as consuming contaminated food can be life-threatening.
A foodborne illness is life-threatening, as well as it can be something that it can pass away after a few days. I always say in Dominica we hardly report foodborne illnesses. We would report the chikungunya or dengue or some other sickness because of the symptoms. People think they are life-threatening. But foodborne illness, you ate something 3, 4, 5 hours after, you may have a foodborne illness. You may vomit or pass stools, and sometimes we blame it on the water. But did you consider what you ate a couple hours before? And because we are living in a culture where, and as long as you feel you have a bad stomach, you take your bourgeois guave or you take your lime skin or whatever to make you feel better, you take that and it would not be reported. If it is reported to us, then the process would be followed, and then we have to do a foodborne investigation to ascertain whether or not you have eaten food that wasn't safe from a particular place.
In all of this, Louis notes that the consumers themselves have a responsibility.
You see the person properly attired, you see the person following basic sanitary conditions, then you make your judgment whether or not you should purchase. Okay, the place is clean, the individual looking well kept, you can make a judgment based on that. You buy hot food hot and cold food cold.
World Health Day has been recognized every April 7th since 1950. The theme this year is food safety, and locally the focus will be on the proper handling of fish. In other news, President of the United States of America, Barack Obama, will pay a state visit to Jamaica on Thursday, April 9, 2015. President Obama and Prime Minister Portia Simpson Miller will hold bilateral discussions on a range of issues of mutual interest. During the visit, Jamaica will host an encounter between President Obama and the heads of government of the Caribbean Community, CARICOM, for discussions on issues on the CARICOM USA agenda, including security and trade. They will also exchange views on regional and international issues of mutual interest. The CARICOM US encounter will be co-chaired by Prime Minister of the Bahamas and current Chairman of CARICOM, Honorable Perry Christie, and President Obama. Live streaming of the opening of the summit can be viewed on www.today.caricom.org from 1 p.m. on Thursday. President Obama and the CARICOM heads of government are expected to proceed from the high-level encounter in Jamaica to Panama City for the 6th Summit of the Americas to be held on April 10th and 11th. You're watching National Focus. Still to come, Dominica to launch first complete health improvement program. Stay tuned.
There is a silent, invisible killer in our midst, a killer which largely goes unnoticed as it plies its deadly trade. Its name is secondhand tobacco smoke, which has a far greater impact on persons inhaling this poison than on smokers themselves. Secondhand tobacco smoke is especially detrimental in public places and negatively impacts our national health as well as public health expenditure. Stop this invisible killer now. Say no to secondhand tobacco smoke in public places. A public health message brought to you by the Ministry of Health and the Pan American Health Organization.
Welcome back. On Thursday, April 2nd, the Ministry of Health, in collaboration with the Eastern Caribbean Conference of Seventh-day Adventists, hosted a health professionals lifestyle medicine workshop to target the prevention, arrest, and reverse of common risk factors for chronic diseases. The one-day seminar was held to introduce healthcare professionals to the Complete Health Improvement Program, or CHIP. CHIP, formerly the Coronary Health Improvement Project, is an affordable lifestyle enrichment program designed to reduce disease risk factors through the adoption of better health habits and appropriate lifestyle modifications. Clinical Professor of Preventative Medication in the United States, Dr. Hans Dale, is facilitator and founder of the program.
The seminar is entitled Preventing and Reversing NCDs, and the first lecture will be focusing on the chronic vascular diseases, their emergence, their escalation, and the economic cost, and how we manage them, because we really don't cure them. We really don't cure them very well, but we symptomatically manage them. We make people more comfortable, which is okay. It has its place, of course, but maybe we can do more by attacking the causes of these problems.
According to Dr. Dale, America is spending over 20% of its income on medical care, 84% of which is used to tackle non-communicable diseases. He says the shocking reality is that these figures are no different in Dominica.
86% of the diseases in Dominica are NCDs, are lifestyle related. Cardiovascular disease, 36%. That's more than we have in America. I mean, percentage-wise. You have another 21% for cancer. And you have now 10% for diabetes. And it's almost all type 2. It's basically self-made. It's culturally promoted.
Dr. Dale highlighted the objectives of the workshop.
To recognize the limitations and cost of high-tech medicine in dealing with and managing lifestyle-related chronic diseases. We're talking about diseases that are related to our lifestyle, how we live, how we eat, how we smoke, how we exercise. Number 2, describe the changes in life expectancy and describe the emergence of our modern chronic diseases. Maybe we have these diseases today only because we live so much longer. These are diseases of aging. We didn't have these diseases 100 years ago because people died too young. So we're going to look at that. And number 3, recognize the role of lifestyle and culture in the etiology of chronic disease epidemic and the need for a lifestyle medicine approach.
The workshop also focused on how to reduce healthcare costs and improve overall health and well-being. It is hoped that healthcare professionals will see the need to incorporate lifestyle intervention in present medical practices to improve emphasis on the prevention of NCDs outside of treatment and medication. Dominica is set to introduce its first complete health improvement program on April 14, 2015. A one-day seminar geared at exploring trade opportunities for Dominica will take place tomorrow, April 8th. The seminar, which is coordinated through the Ministry of Energy, Trade and Employment, will be facilitated by officials from the Government of Dominica and the Commonwealth Secretariat. Mathan Walter, Director of Trade, says that the purpose of this seminar is to further expand the reach of the ministry.
It was realized that many of the sensitization seminars that we have had over the years where trade is concerned have been focused in Roseau and environs, and that you had nothing much happening on the north of the island or even on the east of the island, educating persons there as to opportunities existent for them. And we know that there are persons on that part of the island who are involved in cooperatives, who are involved in producing, persons within the agricultural sector. So we wanted to bring the knowledge down to the north of the island.
The seminar intends to provide the relevant stakeholders in the northern region with information related to market access and entry opportunities available to Dominica through existing trade agreements. It will also seek to indicate the government's role in creating the environment to take advantage of these opportunities, as well as give an insight into the economic partnership agreement.
The reason being that we are well aware of the fact that many of the persons from Clifton and Capuchin, Ansdemere, Solder, Benz, Calibishi, they do a lot of trade with the French DOMs, you know, meaning Martinique, Guadeloupe, Marigal, and Lisette. So we wanted also to highlight what is it in the economic partnership agreement that was signed with the EU that they could be able to also access.
When asked on the importance of the government aspect of the seminar, Walter had this to say.
We are going to look at the government dimension of it. So, okay, yes, these are the benefits in those agreements, but what is it that the government has been doing so as to create an enabling environment for you, the producers, to take advantage of those opportunities? So we have government representatives, myself, the director of the Bureau of Standards, representatives from Dexia. We have someone from the Fisheries Division. We hopefully will have someone from the EPA unit itself. We'll also have someone from the OECS EDU who will be able to identify possible areas where those particular producers can access funds to assist them in taking advantage of those opportunities.
He encourages all stakeholders from the northern region who are directly involved in agricultural sector, cooperative societies, fisheries industry, agro-processing, and other producing businesses to attend the seminar.
Education and knowledge remains key. You know, as much knowledge as you can get in relation to areas of concern to you, you should engage it. And in engaging it, you become saturated with the subject matter. And in becoming saturated, you could be able to take advantage of it. I think more than even that is that the workshop is wide-based, because it's not only looking at telling you of the opportunities, also telling you what is it that government officials has been doing, so that you could be able to, it makes it easy for you to access some of those opportunities. And then we are even saying, hey, there are some sources of funds that you can get to be able to assist you in embracing those markets. We know that, you know, one of the issues that we have had where trade is concerned is what we call supply side constraints. That, you know, we have those markets, but we may not be able to sustainably supply those markets. But we believe that if the producers know that there is a set market for those goods, they understand what they need to penetrate those markets, they will develop the kind of confidence that will allow them to be able to produce enough to sustainably supply those markets. And that is the hope at the end of the day.
The seminar takes place tomorrow, Wednesday, April 8th at the Atlantic View Hotel in Ansime at 9:30 a.m. And before we leave, here's one announcement. ICT 2015 offers to 40 of the most outstanding students, researchers, and innovators under the age of 30 who are academically involved in ICT sector and from a country and university entitled to receive EU funding within the Horizon 2020 Framework Program for Research and Innovation, the opportunity to participate in the conference and join the debates in ICT of specific interest to the young generation. Join the networking sessions and talk with ICT enthusiasts coming from research, politics, industry, startups, investors, and academia. Conduct interviews and communicate with the world through social media. Discover what Europe does to boost innovation and play an important role in selecting and awarding the best exhibition standards. Participants will meet the international scientific community, European ICT entrepreneurs, and European policymakers present at ICT 2015. They will also actively contribute to debates and participate in networking events. The European Commission will cover the travel and accommodation costs for the chosen participants. Do you want to be one of the 40 enthusiastic students, young researchers, and innovators? Find more information on the ICT 2015 event page at ec.europa.eu. Participants must register by 31st May 2015. And that's it for the news. Coming up next, your tip of the day.
Wash your hands. I am Adora Tuse, health educator from the Ministry of Health. Proper hand washing protects against the spread of many common illnesses and germs. Wash your hands often with soap and water, or you may use a hand sanitizer. Remember, clean hands save lives. Protect yourself.
A message from the Health Promotion of the Ministry of Health.
One way of making food unsafe to eat is through cross-contamination. Cross-contamination is the transfer of harmful bacteria from one person, object, or place to another. Preventing cross-contamination is a key factor in preventing foodborne illnesses. Here are a few pointers. When shopping, separate raw meat, poultry, and seafood from other foods in your cart and place these foods in plastic bags to prevent their juices from dripping onto other foods. And when refrigerating, place raw meat, poultry, and seafood in containers or sealed plastic bags to prevent the juices from dripping onto other foods. Raw juices often contain harmful bacteria. Harmful bacteria can spread throughout the kitchen and get onto cutting boards, utensils, and countertops. To prevent this, wash hands with soap and hot water and wash cutting boards, dishes, and countertops with hot soapy water after preparing each food item and before you go on to the next item. And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website news.gov.dm. Like our Facebook page, facebook.com/GIS News Dominica, and follow us on Twitter at GIS Dominica. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. From all of us here on the GIS News Production team, I'm Kimani. Thank you for watching.